I'm Jeanette Wider, and I am Managing Editor of Healthcare Innovation. Today, I'm here with Dr. Joshua Liu, and we're going to talk about digital care journeys, the new trend in patient engagement. So, Dr. Liu, why don't you introduce yourself, your title, your background, your role?
Absolutely. Thank you, Jeanette, for the opportunity to chat with you today. So hi, everyone. My name is Joshua Liu. I actually came from the clinical world. I did my training in medicine a number of years ago. Ended up actually falling in love with quality, safety, and patient experience. Did research at my hospital on preventing readmissions. And I got really excited about using technology to better engage and monitor patients to prevent an outcome such as a readmission. Long story short, met a couple of brilliant engineers, and about 9 years ago, we decided to start Seamless MD to build technology that would actually better support patients and prevent outcomes such as a readmission. And it's been quite the ride ever since.
Great. Okay, so I'm just gonna hop right into the questions now. So first I was thinking if you could tell us a little bit about your company, Seamless MD, and the challenges you're hearing from health systems to solve when it comes to patient engagement. What are you helping them with?
So to take a step back, maybe to start, so I trained as a physician, I've been a patient, I've been a caregiver to a family member going through the healthcare system. And what you realize as a patient going through a healthcare journey is that, whether it's a surgery, a cancer journey, maternity care, a chronic care journey, 95% of that patient journey, really does happen when you're at home alone in the community with very limited support day to day from your healthcare team. And, our providers are giving patients lots of verbal and paper instructions, which patients will tell us that they lose, they forget, there's no day-to-day reinforcement. And then providers will tell us that there's no easy way to keep patients on track, no easy way to follow patients and monitor them. And if patients can't stay on track with their instructions and your care team can't keep an eye on you, bad things can happen, maybe longer than expected, like stay in the hospital, avoidable readmissions. And ultimately, this drives up costs in the healthcare system. But we thought, imagine we could digitally engage and monitor every patient every step of the way throughout these journeys before, during, and after their hospital stay to keep them on track with those instructions, to allow their care team to monitor them and catch problems earlier. What if we could build a world like that? And that's what we do at Seamless MD. And so, for example, let's say you have a patient undergoing a total knee replacement. Patients will access Seamless MD on their smartphone, tablet, or computer, and they're guided step by step, with their pre and post surgery instructions. So what does that mean? So patients would get a just-in-time reminder, a week before surgery to stop their blood thinners on time, or the night before surgery to, make sure you do your antibacterial shower. And then maybe after surgery, they get video-based education on how to do their physiotherapy. And then, at home every day, they're checking in on the app. They are tracking their symptoms, their pain scores, photos of their incision after surgery. And then back at the hospital, we have clinical teams that can actually, right within their EHR, access our dashboards, get alerts, monitor all that data being tracked by patients so they can catch issues much earlier. And that way they can prevent an outcome such as a readmission or otherwise, and improve both the patient experience, but also the value for the health system.
Interesting. I know I'm always losing the paper after I have surgery. It's like, where did I put that? And my husband's like, I don't know. And, you're coming back from surgery, so you can't remember. So as the adoption of solutions for remote patient monitoring and patient engagement increase, which we've been seeing a lot through our interviews and all of the things we're writing at Healthcare Innovation, can you share with us how some healthcare organizations are using the technology?
Yeah, so what's been fascinating is that when we started Seamless MD about 9 years ago, we were initially focused on just the surgical space. That's where we saw the initial adoption. But since then, the use of Seamless has really broadened across all kinds of things, from surgery to maternity care to cancer care, behavioral health, and so forth. And so now, we're being used in dozens of specialties across a wide variety of health system settings. And maybe I'll double click on a couple of examples for you. UAB in Alabama, it's the largest academic hospital in the state, and they've really focused on using Seamless MD to serve high-risk surgical populations. So they're supporting and monitoring patients going through major heart surgery, lung surgery, gynecologic cancer surgery, colon surgery, and so forth. And then we have folks over in Washington State, like MultiCare, where it's more of a large 11 hospital system, and they've fully integrated Seamless with their Epic and MyChart system. And their goal was to deliver standardized, truly differentiated consumer experiences across a lot of their high volume patient journeys. So they've deployed Seamless to hip and knee replacement, maternity care, spine, bariatrics, and so forth. And then we have, we actually serve also the Canadian market, and one of our customers there, Thunder Bay Regional, is this rural hospital that serves a region the size of France. And they have patients who live 2 or 3 hours away, and they're remotely monitoring patients on Seamless from everything from surgery to cancer care to maternity care, really support patients who just can't drive in 2 or 3 hours every time. And so it's been fascinating to see how this is being used across so many different settings, academic, community, rural, urban. It's been phenomenal to see how innovation can work in any setting.
So what's the role of digital care journeys in a health system's digital front door strategy?
So one of the reports I've really liked came out about a year ago from Deloitte and the Scottsdale Institute. And they had this really fascinating roundtable where they had health system executives surveyed on, okay, well, what are your digital transformation priorities going forward in 2021 and beyond? And the two that came up most were number one, improving the consumer experience. Number two, improving health outcomes, all centered around what does digital front door mean for us? And when we look at the digital front door strategy, has it's evolved in the market the last few years, we've seen it initially start off, I'll call it the bookends of the patient journey. So a lot of folks have spent time on how do we do digital patient acquisition and digital search and schedule online. So that starts the patient journey with the system. And a lot of folks have focused on the end of it. How do we do better payments in terms of digital payment experiences for patients? And all that's really important. But I think what was missing for a long time, and that's now come front and center, is what happens in between, during the actual healthcare journey when you're going through a surgery or a cancer journey. And that's where digital care journeys come in. It kind of fills that gap around how do we actually not only improve the consumer experience, but actually engage patients during their actual acute healthcare journey clinically, so we can actually improve their health outcome as well. And we kind of sit right in the middle of that.
Okay. So my next question is, it's a little bit of a multi-tiered question. So how do digital care journeys help health systems differentiate from a competitive perspective, increase revenue, combat staffing challenges, and improve customer retention?
It's a lot of things to tackle there. Maybe the simple way that I think about it is, if you were to ask a patient about their experience with the healthcare system, I really don't think they're going to remember or point out to you, wow, what an amazing payment experience that was. Or I don't think they're going to go back and say, wow, the way that they acquired me as a patient, that was a phenomenal digital experience. But I think what patients do remember, and what we want them to talk about and rave about, is how amazing their experience was during the actual care delivery, how engaged they were, how supported they were when they were most vulnerable, going through an illness or surgery. And we've had so many patients who've been engaged and monitored on Seamless give us feedback around how they've had less anxiety because they knew just in time what to expect from their care team. We've had patients tell us how their life was saved because a blood clot or an infection was caught way faster on our platform, and the nurse picked it up sooner and got the patient treated remotely or brought in to be seen much sooner. We've had patients rave about how they didn't have to travel 2 hours back just to see their clinician, because the clinician could monitor them remotely and just do things from the patient's own home. And these are the really powerful stories, I think, that will actually spread like wildfire and truly differentiate health systems with the consumer experience, which then leads to more patient market share, more revenue, and so forth. The other thing that we think a lot about is how do we actually enable providers to use digital and remote monitoring solutions like Seamless MD, but in a way that doesn't add to staff burnout. I mean, that's been a a really terrible thing that's happened since COVID. And I think one of the challenges of remote monitoring historically is that it was very provider heavy, right? A lot of the traditional monitoring solutions require, let's say, a nurse to being alerted all day long, monitoring all these patients, doing all this extra work they never did before. And that can certainly lead to burnout. We've kind of approached it a bit differently. So we have this really intelligent approach to monitoring where actually when patients record an issue, the baseline level of support from Seamless is that we actually mostly prompt patients on what to do based on their issue. So I'll give you an example. If a patient records that they have some low risk issue like constipation on Seamless, and we find that, by the way, 80% or more of the issues patients record on Seamless are actually low risk things that don't need a provider to like call in and do something. We actually tell a patient what to do. We'll tell them how to manage that constipation at home or how to take care of that low level pain. And we've found that it's actually cut calls back to the hospital or clinic by over 50%. And so what we're doing is we're actually getting rid of a lot of the low risk issues that a provider really shouldn't be spending time on. And we're only escalating or alerting the top 10 or 20% of issues that the clinical team wants to know about and actually are the only people who can help the patient. And that's been a game changer for staff. So tackling the staff burnout piece has been really, really important and a great change for the provider experience with us.
That's great. That's great to hear. We're hearing all the time on the publication, the issues with staffing. That seems to be top of mind for everyone at this time, like you said. So with the ongoing shift to value-based reimbursement, how are health systems using digital care journeys to improve quality and patient safety?
So many ways. I'll touch on a couple that are really common. A really big one lately has been reducing length of stay. And we have all this, data that's come out from different specialties and providers on how they've used digital care journeys to cut length of stay. And people always ask me, well, Josh, like, I get how that prevents readmissions because you're monitoring patients, but how the heck do you cut down length of stay? And we found that it actually has come down to two things. The first is that we're actually getting more patient compliance with evidence-based care plans that lead to earlier discharge. So for example, a lot of evidence-based care plans are getting patients up and moving sooner, walking sooner after, let's say, a surgery, eating sooner. And the data shows that when patients do those things earlier and sooner, they actually feel better and go home sooner. And so we're actually getting patients following those things much more easily. The second thing that we've seen is that just by giving patients and providers this tool to stay connected after discharge, it gives both parties confidence to actually leave hospital half a day or a day sooner. Whereas in the past, they would say, maybe I'll stay an extra day. I'm not totally sure. I feel ready to go home. Now they're saying, oh, you're saying that I'm going to be connected to my provider still through Seamless, even if I go home today. Okay, I'm up for it. And actually, we've had some of our partners dramatically increase the number of same day, let's say, surgeries they do because they have more confidence on both sides of the table to go home earlier. And we have some customers that are doing same day procedures for things like major colon surgery that would have been unheard of, even just a decade ago. So length of stay is a big one. A second big one is around reducing readmissions. As I think we all know, there are penalties for certain readmissions and other value-based care models where we want to cut down on readmissions, but in a safe manner. And certainly the remote monitoring has been really big for that. The last thing I'll touch on has been actually the impact of digital care journeys on tackling the opioid crisis, which is not a really common thing I think we talk about in the media in terms of technology. But actually what we've been doing for many years, particularly with our surgical patients, is helping them track the amount of opioids they take after discharge when they go home. And so we have patients actually who are tracking daily, how many pills of these narcotics did you take? And on the back end of Seamless, we actually have analytics for the providers to understand, well, how many pills are your patients actually consuming? So what we found is that maybe we're prescribing patients at discharge, let's say 30 pills of narcotics for their pain. And the data might show, well, actually patients are only taking 15. Well, now providers have the data and confidence to say, hey, you know what? We don't have to prescribe 30. No one's taking 30. We can drop it to 25, 20, because we have the data to show that patients don't need that many. Whereas in the past, providers would just keep prescribing 30 because they had no idea what the actual usage was. And we even have one customer, Atrium Health, where they actually did an analysis that they presented a couple of years ago at a conference where for major pancreas and liver cancer surgery, they found through Seamless that patients were self-reporting only using about 10% of the opioids they were being prescribed. It was incredible. So that's, I would say, length of stay, readmissions, and cutting down opioid use are kind of three big quality things we're doing.
Right. Really, that's really interesting. So remote patient monitoring, that's not new. So what's different about your offering?
So I like to think of Seamless MD as leading the way for what I call remote patient monitoring 2.0. What does that really mean? So when I think about what health systems were doing for the last decade, I call it remote monitoring 1.0, meaning a lot of them are doing what I call device-based remote monitoring for the top 5% of patients at risk. So what does that mean? So the typical use cases, I'm sure you've seen, Jeanette, has been, I have patients with heart failure, COPD. They're the top 5% of patients at risk of readmission. And we're going to deliver a kit to their home with a blood pressure cuff, a Bluetooth enabled weight scale. And I'm going to have a ton of nursing resources invested to really monitor all these patients in real time. And that's worked out really well for that top 5%. And I think what's changed in the last couple of years is that health systems, as part of their digital transformation strategies, don't only want to support just the top 5%. They want to have a digital experience for 100% of patients, but they also want that in a way that's scalable, where they don't need hundreds and hundreds of nurses monitoring all of these patients throughout their journeys. And for a lot of these journeys, let's say, a knee replacement or a colonoscopy or a cancer journey, those don't really need heavy device-based monitoring. They don't need, tons of nurses monitoring every single issue, but they would benefit from scalable, automated, app-based digital care journeys. And that's what I think of when I say remote monitoring 2.0, and that's what Seamless does. And so the idea is we're often viewed by our partners as a scalable way to reach 100% of patients, whether they have a low risk or high risk journey.
Okay. So what factors should health systems consider when determining their readiness to incorporate digital care journeys as part of their patient engagement strategy?
There are many factors that we could dig into, but I would say there's one specific one I'll really emphasize. And for us, that's been having truly engaged clinical champions. I think one of the things I've learned over the years is it doesn't matter if even the CEO of a health system wants to, implement digital care journeys, or, the chief digital officer, which is probably the new leading role for this. Despite that support, if there aren't strong clinical champions paving the way to the front lines, you just won't be successful. Often now we'll see health systems start in a few specific high volume, high ROI clinical areas like orthopedics, cardiac, maternity, oncology, for example. But what's most critical is that the chiefs of those service lines are incredibly engaged. They're bought in, they're excited, they're spreading their excitement to all the other frontline providers. And then that excitement from everyone in that service line translates to more patient engagement, more adoption, and ultimately you need that adoption to get great results. And that's why actually, we've invested so much in building out more and more of our body of evidence with our clinical partners. What we find is that a lot of digital and IT leaders, often focus on the technical features, but that's not what clinicians care about. Clinicians care about, okay, well, what's the evidence behind this nice looking solution? They don't care about features, they care about outcomes and results on patient experience. And if there isn't strong evidence behind it, it's really hard to get clinical champions paving the way. And so I would say the biggest factor for readiness is find those clinical champions, make sure they're bought in. So that way, if you decide to invest in these solutions, you're set up for success. Otherwise, you're going to bring in something that no one uses, and no one wants that.
Interesting. I wanted to say that the excitement is contagious, right? Like you got to get that going in the system.
Absolutely.
So What measurable outcomes have you seen from your clients who have leveraged digital care journeys to optimize the patient experience? I know you touched on a few before, but if you could give us a few more examples, I think it would be helpful.
Yeah, I really appreciate you asking that, Jeanette. I think a lot of times folks on the digital side, have really, tended to focus a lot on typical, let's call it software engagement metrics. So things like patient activation, usage, and all of that. But I think what's been really telling is that when we talk to our clinical and operational partners, they lean very heavily on, okay, well, it's great that people are using it, but I'm not investing in the strategy to just have a high number of clicks. I want to see impact on outcomes and cost savings and all that, and get real value, tangible value out of it. And so, we've worked really hard to produce outcomes for our clients. And so what's been fascinating is that we've been seeing things like we've had customers who've demonstrated cost savings between $1,000 and $8,000 a patient, reductions in readmissions between 45 to 72%, length of stay reduction between 1 and 2 days, ED visit reduction upwards of 68%, phone call reduction by 50 to 65%. And what's fascinating is that we do all of this while still dramatically improving patient experience. So it's not that we're just improving outcomes with patients who are unhappy. No, they're incredibly happy. They're grateful. We've had patients tell us that. I remember we had a patient tell us that, I wish I had this for my first C-section. It would have made a huge difference. And so when they compare the same experience with and without digital care journeys, it's just that much better. But it does come back to the outcomes. And so I think that's one thing we've really done well. And actually, I'll tell you, with our partners, we are really upfront about, we're going to be annoying about pointing out to you, hey, we've put, hundreds of patients through Seamless at your organization. We really want to do an outcomes analysis. We really want to show you that this has made a difference, because if it hasn't, then we're frankly not satisfied. And I don't think enough vendors care about that. Because at the end of the day, it's a partnership and we want to create value. And if we're not, then why are we doing this? Why are you spending your time and money with us? So I appreciate you asking. The outcomes have been really important.
Oh yeah, that's a great answer. Okay, so I'm going to ask you some advice-based questions next. So what advice do you have for health systems who are embracing technologies and putting these new practices in place and gearing up to deliver digital care journeys to their patients?
Yeah, I'm going to answer that question in a bit of a roundabout way, but I'll get to a point. So bear with me.
No problem.
People often ask me, how is it that Seamless has produced those amazing, clinical results that we just talked about a minute ago? What's your secret sauce? And I think the biggest lesson for us on that has been, the technology is just a tool, but you need tech with a great implementation to get results, to get a fantastic solution. And so for us, what we've really learned about how do we actually get great practice in place and make health systems successful has actually been the clinical DNA in our team. And so, and this is important, by the way, because unlike some of these other digital patient engagement solutions focused on the bookends of, search and schedule or payments, those aren't really clinical solutions. But Seamless, because we provide, clinical content and care plans that, yes, come out of the box, but actually end up being customized by frontline clinicians at a health system, because every health system does things a little bit differently. It's really important that we have a clinical mindset in working with our partners. And so I think the biggest piece of advice for health systems is, if you're going to go down this route with a technology partner, really focus on a partner who puts the clinical aspect at the center, and not just in what they say, but in what they do and the team that they assign to working with you. So for example, when we implement the solution with the health system, one of the types of team members that is part of that implementation from our side is someone called a patient education specialist. And this is someone who comes from a clinical background in some way. They are nurses, pharmacists, dietitians, health communication specialists, and they're the ones who actually lead the frontline clinicians through all the customization and configuration of the content and protocols on Seamless. And it's been amazing to see the value of that, because we've had customers all the time say, Seamless, when we heard that we were going to implement your solution, a lot of our staff thought, oh no, yet another tech vendor who doesn't understand, clinical lingo, doesn't understand what my vision is. But then when they work with our team and they say, oh my gosh, I didn't have to change the way I spoke. Your clinical team could sit side by side with me. I actually took a lot of their recommendations because they were clinical and they've lived this with me. And that's really strengthened their confidence and belief and success implementing our solution, because they all spoke the same language and had shared values and experiences. And so I just would really advise health systems, if you're implementing digital care journeys, realize it's not a tech solution, it truly is a clinical solution, and make sure your partners are bringing that clinical DNA to the table. Otherwise, you might be left with yet another app that looks nice, but doesn't actually make sense clinically and your patients won't actually use.
Well, very well said. So the final thing I'd like to discuss today, and this is kind of a loaded question, but how do you see digital patient engagement evolving, maybe for the rest of 2022 and beyond? Let's even say 5-10 years from now.
So I'm going to be a broken record on this one, Jeanette. And for me, and again, I'm biased because, as the CEO of Seamless MD, I live the digital care journey mission. But I really, really do think that digital patient engagement is on the early innings of this evolution away from, let's call it operational digital patient engagement, to something more clinical and patient focused around the healthcare journey. So I think going forward, more and more health systems are going to have already checked off, I've done my digital appointment booking, solutions. I've done my digital payment, solutions, my kiosks, et cetera. That's all table stakes now, frankly, for health systems. And now it's about, okay, how am I going to leverage digital patient engagement to truly guide patients through the actual healthcare part of their healthcare journey? How do I actually drive an improved health outcome? How do I succeed in an increasingly value-based care environment? And for them, that's going to be knowing that it's no longer good enough to just say, hey, we're doing digital and monitoring for the top 5% of patients at risk. I need to find a way to better care for patients digitally at scale for 100% of my patients. And I think the health systems who figure this out quickly are going to be the real big winners from all of this. And it's going to be their patients who get better care because of this transformation. And that's going to make winners out of everyone. So I do think digital care journeys are the next big thing in digital patient engagement. I still think we're in the early innings of it, but I think 5 years from now, it's absolutely going to be the standard of care. And if you're going to stay ahead of the curve, I think it's something that folks have to start looking into now.
Great. Very, very insightful. Unfortunately, that's all the time we have today. So Dr. Liu, I want to thank you for having this conversation with me. It was incredibly interesting.
Thank you, Jeanette. I really appreciate the time to share our story and our learnings.